106.8. Call 1890 441068 or text for 30 cent on 087 787 1068.
Okay, Dublin is talking. I'm Lyndsey Dolan with you until 11 o'clock this morning. He's known as the cosmetic surgeon to the stars. Dr. Patrick Treacy from the Ailesbury Clinic is in studio. Hello, Patrick. How are you?
Good morning, Lyndsey. How are you?
I'm very well. Good to talk to you again. How's life?
It's pretty good. But, we had a social in-person party last night, which was wonderful, and it's nice to see Dublin back out enjoying itself again.
Good stuff.
Absolutely.
Okay. Today we're talking about stretch marks and the fact that you can now have them removed.
I wouldn't say so much removed. Stretch marks are a very interesting phenomenon, and I suppose stretch marks are in some ways like a scar.
Yeah.
And in many ways, a lot of people remember the World Trade Center after it was hit, and I don't want in any way to use the death of those people as an analogy, but we all remember the structure that was standing there, the big lattice things, and stretch marks are very like this. What had happened there was, I suppose, the front covering of the building had fallen, and we've seen the sort of infrastructure that held the whole thing up. The dermis is what we're seeing through the skin, the protective horny layer that covers it, the epidermis is missing, and we get these pink to red sort of, we call them in medicine stria, and then over a period of time, as they get a little bit of covering, epidermis over them, then they sort of gradually fade, but we see them within. What can we do about them? Well, why do they occur first? They occur exactly as they say, they're stretch marks.
Stretch.
So during, we say, puberty, when somebody's growing fast, during periods of time when, obviously during the third trimester of pregnancy, when skin is under pressure, the epidermis to an extent gives, and we see the dermis underneath. It can also happen, very interestingly, in people who are transsexuals, people who are putting on muscle bulk and all the rest, and the reason for that's slightly different. These people are taking glucocorticoids, and as a consequence, collagen can't grow properly, so we're in some ways making the infrastructure a little bit sort of weaker or a deficit. What can we do about it? Well, the answer really is lying what we're looking at. We need to get epidermis out of dermis. So how do we do that? To date, we have been able to do very little with them. Main reason is that if we use things like peels only go down as far as the upper layer of the dermis, and it can't really generate new collagen. So, it's a fascinating area we live in now, because we have all these new ways of approaching it. If we shoot a fractionalized laser into the skin, in some ways we injure the dermis, we kick off new fibroblasts, collagen grows. If we also use something like a derma roller, which is a very simple little device where we can sort of roll little needles into the skin, this is the same as falling off a bike. In other words, you cut your hand and new skin grows. And of course, another wonderful way that we have is a thing called RioBlush. And this is only a machine that has come from America within the last year or so. And what we can do is inject carbon dioxide into the skin, and we fool the body. The body sees carbon dioxide there. They said, oh, what's going on? We need to shoot new blood into this area. We need to bring oxygen to the area. And when new blood flow comes, we get a thing called neovascularization. This initiates a process called neocollagenesis, which is growing new collagen. And as a consequence of that, new epithelium will grow out of the dermis also.
Okay, well, that's very medical. But
okay.
For somebody who wouldn't have any medical knowledge, exactly how can you, I suppose, get rid of them or you know,
well, the interesting thing is, sure, the topical solutions to date have some effect. Most clinical trials, except for the one on cocoa butter, if you use things that have got vitamin E, if you use things that have got hyaluronic acid, these will get into the dermis because it doesn't have a protective cover and kick off some new collagen. But the best thing to do is certainly go to one of the more specialised clinics that can either offer laser resurfacing and use fractionalized. This is the new buzzword in laser resurfacing, where you don't want to take off all the skin. You just want to shoot little holes down at it to annoy the skin to start regrowing itself. And or derma rolling, which is a fairly common technique throughout most of Ireland now. Even sort of some beauty salons are using it, but you'd need to use needles of at least 1.5 to 2 millimeters. The small needles, you need to draw blood. You need to get into the dermis. It needs to hurt where the nerve endings are, where the blood vessels are. Then it works. And of course, RioBlush. I think we're the only clinic that has RioBlush in Ireland, but I'm sure as things change, this is a wonderful machine that's not only used for stretch marks, pigmentation. Even the hospitals are probably going to take it on board for diabetic ulcers. It is the most interesting phenomenon. If you just take ulcers alone, we always thought you had to get oxygen into the ulcer, which is common sense. But when we put oxygen in the ulcer, it shuts down and it gets worse. We always know that. But somebody thought back to front in Italy, actually, about 20 years ago and said, okay, the very thing we don't want to get there is carbon dioxide. And when we started injecting carbon dioxide into the ulcers, suddenly they all got better. And it's just fooling the body that things are so bad that there's no oxygen there at all and it grows new blood vessels. It sort of kicks off a different type of synthesis through a stimuli.
Very good. I mean, it sounds, for a lot of people, would be looking at this as an option because, I mean, you'd see young girls and, you know, just from growing or losing weight or gaining weight, the stretch marks on the arms, on the back of the legs. I'm not just talking about stretch marks in pregnancy.
Yes.
Because there's an awful lot of products out there today that can do a lot to help the skin stretch itself and mold, go back in, and you can have a quite healthy 9-month pregnancy without one stretch mark.
Absolutely. And the interesting thing as well is the skin is different in different places in the body. The skin in the face can regenerate the outer layer of skin. The skin in the neck can do it a little less, and usually the skin in the abdomen, the legs, or the arms where stretch marks occur is where the inner layer of skin can't really form the outer layer. So that's why we have to sort of in some ways fool it that we're injuring it, that the little power it has to regenerate the outer layer, the epidermis, can be done by the methods mentioned. But certainly even 5 years ago we had very, very little to offer patients, and it is so common. I mean, we certainly would get 3 to 4 calls a week on stretch marks alone.
Okay, so I mean, if people want to go and get more information on this, how can they?
Probably one of the easiest ways is to go onto the websites, but I mean, if you consider that you're probably going to be offered one of 3 things. If it's laser resurfacing, make sure it's fractionalized CO2. That is the one that sort of seems to be the most effective. If it is derma rolling, you need long enough needles, 1.5 or 2 millimeter needles, and it's usually medical people that sort of will be associated with that. Or some of the other things like radiofrequency, it has to be Polaris. Usually things like skin peels did have a therapeutic use some years ago, and I would never sort of knock anything. Technology has got better, and probably for the same price there are better options now. And of course the RioBlush machine is probably going to take over, because this we're doing clinical trials on it. We've done 10 patients to date over about the last 6 months, and some patients have totally lost their stretch marks altogether, which I've never seen in all the years of medicine.
Well, I mean, just give us the contact details there for you, and I know you have a few clinics, but
okay, well,
the website is probably the best one.
Ailesburyclinic.ie is the cosmetic end of our business, and the phone number for Dublin is 01-269-2255. In Cork, it's 021-485-7744, and I suppose Ailesbury Hair Clinic is ailesburyhairclinic.com. It's a different part of the business.
Okay, well, it's always a pleasure to talk to you.
And a pleasure with you. Thank you, Lyndsey.
Thank you very much for joining us this morning. That is Dr. Patrick Treacy from the Ailesbury Clinic. Stretch marks can be a thing of the past.